Here in the Special Care Baby Unit, also known as Scbu, we care for babies from 32 weeks gestation and above. They may be with us for a few hours or a few weeks, depending on their needs. We are an 8-bedded unit with 1 ICU space. There are many reasons why your baby may come to Scbu. We aim to ensure that you and your baby receive excellent round-the-clock care from our specialised team, where family-centred care is at the core of our philosophy. You will be encouraged and supported to fully participate in all aspects of your baby's care.
Hi, I am Sheila, one of the lactation consultants here at Portiuncula University Hospital. I am here to support you and ensure you have the confidence, knowledge and skills to breastfeed your baby successfully. Breastfeeding is one of the greatest gifts you can give your baby. Your breast milk protects your baby against many illnesses and conditions. It is designed to meet your baby's every need. Your breast milk contains essential enzymes, hormones and antibodies. These are vital for your baby's normal growth, development and good health. While breastfeeding is the most natural way to feed your baby, it is a skill that you and your baby need to learn together. Breastfeeding takes patience and practice in the early days, but with the right help and support, you can start breastfeeding and continue for as long as you want to. You will soon learn your baby's early hunger cues. Eyes fluttering, moving their hands to their mouth, making mouth movements, moving towards your breast or turning their head when you touch their cheek. Crying is a late sign of hunger. Try feeding when you notice your baby giving you these early signs. It will often be easier as you'll both be calmer and more relaxed. There are many ways that you can position your baby to breastfeed. Whichever way is most comfortable for you is best. Correct position and attachment is the most important thing for successful breastfeeding and prevents many problems. Therefore, it is worth practicing to get it right from the beginning. Bring your baby close, tummy to mummy, facing the breast directly with their nose level with your nipple. Try and keep your baby's head and body in a straight line. Avoid holding the back of your baby's head. Their neck and body can be supported with your forearm. Gently brush your baby's top lip with your nipple. This should help them open their mouth wide. When your baby's mouth is open wide, quickly bring your baby to your breast with your nipple aimed at the roof of their mouth. The wider their mouth is open, the deeper the latch should be. When they attach, your nipple and most of the areola should be deep within the baby's mouth at the soft palate. And your baby's chin should be pressed into your breast. Your baby's cheek will appear fuller and you will start to see your baby suck and swallow rhythmically. If you need to detach your baby and reattach to change position, place the clean finger in the corner of your baby's mouth between the gum and break the suction and release your nipple. Breast milk is designed perfectly for your baby. Feeding frequently in the early days and weeks helps make sure that your baby is getting enough milk and that your body is making the right amount of milk. It is common for newborns to feed at least 8 to 12 times in a 24-hour period, including overnight. Feed your baby as often as they want. Offering both breasts at each feed ensures that your baby gets adequate milk volumes. The length of a breastfeed will be determined by your baby's interest and response. Offer the breast you finished with last. on the feed following. Cluster feeding is normal. Newborns have periods where they may feed very frequently for a few hours, and these feeds are often followed by longer periods of sleep. These cluster feedings will often settle quickly over a day or two. If your baby is sleepy, you may need to wake them to feed to ensure they're getting enough milk. Everyone's breastfeeding journey is different, and we are here to help you and support you so that you can achieve your breastfeeding goals. Please ask your midwife for more information or contact us directly on 090 96 24 619.
Wash and sterilize bottles for first year of baby's life. To make bottles, boil 1 liter of freshly drawn tap water. Leave this to cool for 30 minutes. Clean surfaces well and wash your hands. Pour the cold boiled water into a sterilized bottle. Add the formula using the scoop provided and following the instructions. 30 ml of water per scoop of powder, 1 ounce. Ensure the scoop of powder is a level scoop. Screw the teeth, put on the bottle's lid and roll to dissolve the powder. Cool the bottle under a cold tap. Check the temperature of the bottle on your wrist before you feed your baby. Throw away any feed not used after 2 hours. Your baby should increase bottle feeds gradually every day. At a week old, your baby should be taking 3 to 4 ounces or 90 to 120 ml of milk every 3 to 4 hours.
Hi, my name is Macy and I'm a midwife here in Portwinkler Hospital. I'm going to show you how to bath your baby. Bath time is a chance for you and your baby to have fun, play and interact. A bath once or twice a week is enough to keep your baby clean. Firstly, make sure the room is warm. Gather everything you need before you start the bath. This includes towels, cotton wool, clean nappy and clothes. Fill the baby bath basin or sink until it has 8 to 10 centimeters of water in it. The water should be just high enough to cover your baby's tummy. Make sure the bath water is the right temperature, about 36 degrees Celsius. You can check this with your elbow. If it's too hot for your elbow, it's too hot for the baby. Undress the baby, leaving their nappy on and wrap them in a towel. Using the rugby hold, lift your baby over to the bath and clean their face and eyes using cotton balls, 1 for each eye. Hold your baby's head over the basin and wash their hair using only water. Dry your baby's head and then take off their nappy. Lift your baby into the water with one arm behind their shoulders and neck, holding their outside arm with your hand. Place your other hand under their bottom. Lower your baby slowly into the water so they do not feel as though they are falling. When their bottom is resting on the floor of the basin or bath, you can free that hand to wash them. Use your other hand to keep your baby's head out of the water. After you've bathed them, slip your free arm back under their bottom. Hold their legs with that arm as they will now be slippery. Then lift them out onto the towel. Pat them dry. Do not forget their skin folds and creases. Dress your baby. Empty the bath or sink.
Changing your newborn's nappy is one of those things you'll be doing 7 or 8 times a day, so it's best to be organised from the start. Make sure you have everything you need ready and close to hand. Place your baby on a clean, soft, flat surface. Open the nappy and wipe away excess stools from the genital area with the corner of the nappy. Hold your baby by the ankles and lift up their bottom. Use soft cotton balls or a wet cloth to clean your baby. Clean around the umbilical cord area. For a girl, be sure to wipe from front to back. This will help minimise the spread of an infection. Swap a clean nappy for the dirty one. Use the tabs to see which way goes up. Avoid covering the umbilical cord as this can cause irritation. For a boy, keep his penis pointed down. Fasten the nappy at both sides with the tapes, making sure it's snug, but not so tight that it pinches the skin. Retape the soiled nappy around the contents, put it in a plastic bag and discard it in the bin. Dress your baby and wash your hands thoroughly. Babies wet their nappies several times a day. The number of wet nappies is a helpful sign of how much fluid the baby is taking in. Generally, a baby should have 5 to 6 wet nappies each day. This is a good indication that they're getting enough milk.
Hi, I'm Amanda. I will be discussing a very important talk around safe sleep for your baby. Safe sleep practice is important to reduce and prevent the risk of sudden infant death syndrome. Babies have no concept of day or night, especially in the first few weeks of life, and tend to eat and sleep as part of their routine. Babies can sleep from 10 to 18 hours per day. As your baby gets older, their wakening periods increase and they will develop a pattern of sleep. The parent's bedroom is the safest environment for a baby to sleep in during the first 6 months. Babies should sleep on a firm flat mattress in a cot. Keep the cot away from areas with drafts or radiators, as babies cannot control their own body temperature. A comfortable temperature for a bedroom for a baby is between 16 and 18 degrees. Avoid having any stuffed animals or toys in the cot. Babies should sleep on their backs with their feet at the bottom of the cot, and we recommend cellular blankets coming no further than the baby's chest, tucked loosely but securely. We do not recommend co-sleeping. However, if your baby does sleep in your bed, ensure they are on a hard, flat surface, keeping pillows and adult bedding away from your baby. Never sleep in the bed with your baby if you have consumed alcohol or any drugs. Remember to check your baby often to ensure that they are sleeping safely and comfortably.
Hi, my name is Paula. I am a senior paediatric physiotherapist working in the Portiuncula University Hospital. In this video, we will briefly discuss tummy time, plagiocephaly and torticollis. You may notice a flat spot developing on the side or back of your baby's head, and this is known as plagiocephaly. This happens because your baby's head is soft and can easily change shape. Your baby might prefer sleeping with their head turned to one direction, and you can reduce the incidence of flattening occurring by changing the baby's head position. Any head flattening should improve naturally as your baby gets older and the bones in their head gradually fuse together. Your baby's flattened head will not cause pressure on their brain or any developmental problems. If your baby has a mild case of plagiocephaly, they usually do not need to see a physiotherapist. The condition will usually improve if you follow the advice on the hse.ie website. Search for plagiocephaly or flat head and click the link Flat Head Syndrome in babies. Only babies with serious cases of plagiocephaly are referred to a physiotherapist. One reason for plagiocephaly emerging is if your baby has a torticollis. That's when they tilt their head down to one side or avoid turning their head in one direction. Take your baby to see your public health nurse or GP as soon as possible if you notice they have these symptoms. With the help of physiotherapy, most babies with torticollis get better through position changes and stretching exercises. Depending on the age of your baby, it may take weeks or months to fully correct. Tummy time helps to strengthen your baby's head, neck and back muscles and helps reduce the incidence of your baby developing a flat spot on their head. Your baby can begin tummy time from the day they are born. They can continue to do tummy time throughout their first year. More tips on how to do various forms of tummy time can be found on hse.ie and search for tummy time.
As a parent, your worst nightmare is finding your baby not breathing or blue. The following steps will show you how to administer CPR to a baby who is not breathing. Gently stimulate the baby by tapping or rubbing the baby's foot or gently squeezing the baby's hand. If the infant is unresponsive, call for help or call an ambulance, dialing 999 or 112. Lay the baby on a flat surface and tilt the baby's head back into a neutral position. Open the mouth and look for any obstruction. If there is an obstruction, remove it. Check for breathing by looking for chest movement, listening or feeling breath on your ear. Do so for no longer than 10 seconds. If baby is not breathing, cover the baby's nose and mouth with your mouth and give 5 rescue breaths. Ensure there is a good seal and that you can see the chest rise with the breaths. Each breath should last 1 second in duration. If there are no signs of life from the infant, then you will need to begin chest compressions. Place the tips of 2 fingers on the lower half of the breastbone just below the nipple line and push down firmly and fast to a depth of 4 centimeters. Give 30 compressions and give 2 more breaths followed by 30 compressions. Continue this sequence until the baby responds or until the ambulance arrives and somebody is available to continue infant CPR.
12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30.
We sincerely hope that you will never be faced with this scenario, but this skill is an easy and effective tool that may potentially save an infant's life. If your child is choking, he may appear distressed. He may have a silent cough or cry. His face will be pale and his lips may be blue. If this happens, supporting your baby's head and neck with his head lower than the level of his chest, in between his shoulder blades with the heel of your hand, you need to hit him hard 5 times. Don't worry about hurting your baby. You need to relieve this obstruction. Generally, back blows are enough to relieve the obstruction, but if your baby is still not breathing, you need to do 5 chest thrusts. This is done by using your 2 fingers in between the nipples, the lower half of his breastbone, going on an inward and upward motion to your baby's head. 1, 2, 3, 4, 5. You're going to continue doing chest thrusts and back blows until the object comes out or your baby goes unresponsive. If your baby goes unresponsive, you need to follow the guidelines for infant CPR. If you see the object in your baby's mouth and it is easy to remove it. However, never put your finger blindly into your baby's mouth, as you could push the object further back or you could injure the inside of their mouth, causing more problems. If your child has had a choking episode, they need to be followed up by a doctor.
Erythema toxicum, also known as erythema toxicum neonatorum or toxic erythema of the newborn, is a common rash seen in full-term newborns. It usually appears in the first few days after birth and fades within a week. Up to half of all newborns will have erythema toxicum. The rash can be on the baby's face, chest, arms and legs, but usually won't be on the palms or soles of the feet. It's a blotchy red rash with small bumps that can be filled with fluid. Although this fluid might look like pus, there is no infection. Because erythema toxicum doesn't cause any symptoms and goes away on its own, no treatment is generally needed. Follow your doctor's advice about caring for your baby's skin. Call your doctor if your baby has a rash and is also fussy, not feeding well or has a fever. Respiratory syncytial virus, also known as RSV, is a common respiratory problem that we see in young children and newborns. Common symptoms include lethargy, which also means lack of energy, poor feeding or breathing difficulties. Most healthy infants infected with RSV do not need to stay in hospital. unless your doctor is concerned about your baby's feeding or breathing. Treatments may include hydration, which involves a drip or oral fluids, and sometimes oxygen therapy. Infection with RSV in older children usually presents as a cough or a cold. RSV is spread by direct or close contact with secretions. RSV can live on surfaces such as toys for many hours and for half an hour or more on the hands. Hand washing and room cleaning should help minimise the risk of spread. The incubation period ranges from 2 to 8 days. Isolation of children with RSV infection is recommended, and this can be up to 1 week. Patients with RSV infection shed the virus usually between 3 to 8 days. If you're concerned about your baby, you should contact your healthcare provider for assessment.